It is just a huge honor for me today to be podcast interviewing a legend in cosmetic dentistry.
My honor, thank you.
A dentist, a physician, a plastic surgeon. So this MegaGen conference is, the lineup of speakers, everyone's world class. Just to even get to speak at this show is just a huge honor. And this guy is probably the biggest name at the entire show. He's from Hamburg, Germany, which unfortunately, whatever they taught you in school, that's not where the hamburger was invented. He just told me that it was not. But Doctor, that's how they do it in Europe. If you're an MD and a dentist, they call you Doctor. Dr. Steffen Hohl studied medicine and dentistry at the Goethe University Frankfurt in Germany. He began his clinical training at Harvard Medical School in Boston, Massachusetts, where he trained in emergency medicine, plastic surgery, and neurosurgery at Boston, Massachusetts General Hospital and Brigham and Women's Hospital. He subsequently trained as a dentist for oral maxillofacial surgery at the University of Cologne and the Interdisciplinary Trauma Center in Dortmund, qualifying 4 years later as a consultant for oral and maxillofacial surgery and a dentist specializing in oral surgery. In 2005, he established his practice for oral maxillofacial surgery and aesthetic dentistry in Buxtehude in northern Germany, where he is clinical director. Die Zahnerei is also a training and professional development center for implantology and aesthetic dentistry. Dr. Hohl has over 20 years experience of implant training. In 2005, he became the author of the book Metamorphoses of Smile and a Patient Guide on Implantology. To date, he has published over 50 articles in international scientific and medical journals, both in Germany and international. He is the creator of the smile changer concept. He also developed the world's first soft sedation process called Schlaf-schön-Sedierung that he's been using regularly in his practice since 2014. With more than 20 years experience in dental implantology, soft tissue management, and implant restoration, he has brought together his own proprietary treatment concept known as the SOAP success concept. And what does SOAP stand for?
Subjective, objective assessment and plan.
Okay,
which is a really common rule in the United States, but I use it differently.
But what was the name of your lecture here?
The smile changer concept.
Okay, I thought, when I saw that S, I thought it was the smile changer. I didn't think it was the what we learned. His specific interests are the smile changer concept, SOAP success concept, immediate implantation and immediate loading. Other practice areas include aesthetic soft tissue management, plastic periodontal surgery. Another focus is 3D planning and 3D reconstruction. What I'm going to do now, if you're listening to this on iTunes, you got to switch over to YouTube. On YouTube, we're youtube.com/Dental Town Magazine. Thank you to the 9,000 dentists who subscribe to us on that. But I want to show you these videos. The first video, I mean, because people do bleaching, bonding, veneers, they do braces, but man, you do the whole face as a plastic surgeon. This lady basically... You notice how when people are older, they're like me, I'm 56, your big fat face hangs down so you don't see any upper teeth. And then when they get older, you start to see your lower teeth. And by the time you start to see their lower gums, they're always like 70 years old. The best giveaway that guy said, see me, you don't see upper teeth, you just see lower teeth, so you know I'm 56. But by the time you start seeing just lower gums, and what you're doing is you're doing surgery and lifting up the upper face, but these videos are to die for. Let's play them now, all four of those. your work is revolutionary. So talk us about what first of all, explain that surgery on your website where the lady doesn't show teeth and you just lift up her.
The smile changer concept is actually a 3-phase surgical concept, and it starts from facially driven dentistry originally. Because the problem is usually you have people and they lose their teeth. Probably they start being 50 or more years old, and then they have other problems going on the same time. For example, they have to deal with skin aging, which means that you have a prolonged upper lip that is completely in the way of seeing the teeth of the patient. And dentists sometimes worldwide, they think they can make bigger teeth, so the prolonged lip is not in the way anymore. But for example, in Germany we have special words for that. For example, a lady saw me last year, she said, "I hate these horse teeth my former dentist gave me." But I can actually understand why this was the case, because the dentist thought, I just have to overcome that big lip that is so long by giving her bigger teeth. But that does not work out. The lady would not look good, and she felt like a horse. As you said, you would kill 100 horses. That is something you don't make friends with your patients. So you need to do something about the lip. The problem is with skin aging, the lip, especially the upper lip, is not getting only longer, but also thinner. So you have to do something about the volume, and you have to do something about the vertical dimension, the length. So we make a beautiful small incision beneath the nose. We put in fillers to create a beautiful 3-dimensional volume again. But the problem is, and that goes back to neuroscience actually. There was a French guy, his name was Guillaume Duchenne. He was a French neuroscientist. And he did studies, I think, for decades to find out how a real smile is defined. And a real smile needs certain things. It needs 3 steps. You need to show beautiful teeth. You need some muscles lifting up your oral angles, and you need some wrinkling around your eyes.
You do need wrinkling around your eyes?
You need some wrinkling.
Some wrinkling around your eyes?
So a lot of people want to get rid of those wrinkles, but you need some wrinkles. And what you need is you need to get rid of the excessive skin around your eyes so actually somebody can see your eyes. Because the glance from your eyes is the fluid on your eyes that you only see when there's light in the room and there's the right emotion. And there's like 2 different kinds of smiles. We call it a social or a fake smile, or a Pan Am smile, because all the flight attendants from the Pan Am was forced to show a social smile, just like doing this. Show a bit of your teeth, just lifting up your cheeks. And that is now the neuroscience part. To do so, you only need your vertebral cortex. So you do it willingly. You use the major zygomatico muscle to show a fake smile, okay? But there's nothing going on around your eyes. If you want to use your orbicularis oculi muscles, you need your limbic system. So that means to show a real smile, you need to have emotions. That is the big difference. For a social smile, you can be tired, exhausted, without sleep. Everybody can do a social smile. He just has to lift up his cheeks. But you show a real smile, and that's the base of that 3-stage concept. We give them back their teeth. We do something that they can actually lift up their lips and show their teeth. And in the last step, we do something about putting back that glance in their eyes. So, and in that situation, you will see, I will show some results, for example, tomorrow, or you can see that on my homepage and in the videos, that these people who got treated with a smile changer concept, they look natural, but they look like minimum 10 years younger. They don't look like being operated, or they don't have weird faces. They just look natural, but they were brought back 10 years in time. And that's the moment when I see the result of my smile changer concept, giving somebody back the ability to show a real smile.
Now, how would you say that's different than the average American facelift, which does a lot of times looks unnatural? I mean,
yeah, because it pulls the wrong strings in my eyes.
Right.
Because for some people it is really useful, but I see an indication for a face combined neck lift when somebody has really excessive skin around his neck and excessive skin around his cheeks, but you do not treat the right areas when you are really about to smile. When you're interested about giving somebody back a unique and beautiful and young smile, you need to treat those 3 stages. So it is not helpful to give somebody that
right.
stretched look, because it does not treat the right areas. And sometimes you can see pictures on the internet. I saw videos maybe from colleagues, and the dentist were putting in some beautiful teeth, really nice work, brilliant colleagues, and then a plastic surgeon would maybe do something like a lip lift and put in some volume in the lips due to using fillers or something. But then the people would still look tired, exhausted, because they still would have excessive skin around their eyes. Nobody did something for the whole thing. Like, my concept is based on seeing the whole person, the whole face, doing something about the whole smile. If you only treat a little part of that, like only giving back the teeth, only doing a lip lift, only using fillers because the patient is scared of that little surgical procedure, then you will not reach the highest goal that is there. Because those people, when you take photos before and after, you can see there's something missing. They are still looking sad. Maybe they appear tired or something. So you need to treat these 3 stages. And you know what, I have to admit, I'm not that smart. So I had to find out over a period of time what I have to do, how much I have to do, that it still looks natural, but I can put patients back in time. I can give them 10 years or more, and they look natural. I start very frequently that during the first appointment, I talk to mostly ladies in their mid-50s, and I ask them, could you give me a picture? And then they show me their mobile phone. I said, no, I need a picture of your face that is from the time before they had the mobile phones. So bring me something printed when you were 20 or 17. And sometimes that procedure takes time, let's say 4 weeks, and then I have that picture, and then I need to see the goal that I'm planning on doing in my mind. I make a picture of where I want to go, and then I talk the person through the whole process. And actually, the first question that I get is, wow, when I show them pictures from other people, how many years will that take? And I say, yeah, we are done in 4 weeks. And they say, yeah, what, do I have to lay in a hospital for 4 weeks? And I say, no, we have one surgical procedure where you can treat your teeth, and you go home and you wake up with fixed teeth in your mouth. And the second one will, if you want that way, we can do the treatment of the lips, but if you're lucky, we can also do the treatment of your eyes the same day. So it's your decision, whatever you want. It's usually 2 to 3 hours procedures. And then we're actually done in 2 steps. The fastest thing I did this year was it took 3 weeks. And then we were actually done with everything. It will be healed up after 6 weeks, finally. Then we do the final photo session, and we do a lot of videos. And the most fun point is, when I do videos before, the woman that I treated looked sad. She was crying the whole time. She was covering her mouth with some tissue. She was just looking down the floor, and I took a video of that. And then 4 weeks later, I took another video. Once she was done, she got dressed up. She went to the hairdresser, which she never went the last 20 years of her life. And then I showed her that old video. And we were video recording that scene. So you can imagine, she was actually laughing at herself. She was thinking, wow, how ugly would I run around? So, and look at me now. I have the chance to start over again. So that is actually a very, very emotional thing for me. I love that. I get chicken pox on my whole upper body when I think about these scenes, because that is like really emotional for me. For me, it's just little surgical procedures, just following the whole plan. And sometimes you have that spark flipping over that you really had the chance to change somebody's life.
And to take it all the way to the dark side, I remember reading a study by soldiers who lost their lower jaw during wartime.
Yes.
At 5 years, it was almost 100% suicide.
Yes.
So if you lost your mandible and they sewed it shut, and you were going to have to go through life without a lower mandible, it was too much for almost every single soldier.
It's horrible. Most of the people, because I worked in trauma centers like 1/3 of my surgical career, and I saw all these cases from young people to old people to cancer patients or whatever. There's different reasons why somebody can lose his lower jaw, for example. And that is so dramatic that when you describe that situation to somebody on the street who is not even a dentist or has no clue about dentistry, they cannot even imagine how much that ruins your life. You cannot chew. You look weird. Everybody will stare at you on the street. You will never find somebody that you would actually trust to kiss. So your emotional life is pretty much done in that life. So that is like really, really dramatic. And that is actually a good point that you just made there, because that was my starting point. That was when I was thinking about somebody's smile is completely gone. The ability to smile is completely gone. There's no chance that this person can ever smile again. And that made me thinking, so what do you need to do? What can you do with people who have to do with skin aging or wounds or scars, or even when you start with people who have no teeth at all? They have edontalous jaws and ugly dentures. They are sometimes also in the same situation like the guys with no jaw, because the result is the same. They cannot chew properly. The TMJ is completely out of range. They have pain the whole day. They do not dare to open up their mouths. When they are invited to a restaurant, they look at the menu and they go, do we have something soft maybe? So they cannot even eat properly. Then they get problems with their digestion. And actually, for me, the worst part is when they enter the clinic and I see them the first time. And that is something that human beings can tell right away, that somebody is really ashamed of himself. That is horrible to see, because they stare at the floor. You see tears running down their faces. They cover their mouth. When you talk to them, they still cover their mouth with something. They hold some piece of paper or some tissue in front of their faces, and you feel depressed while you are talking to them because you feel so sorry. You think, wow, how horrible must that be to run around even for one day in your life and sit in that situation. So in the earlier days, let's say 20 years ago, it would be like a big deal, because nobody would know about techniques, and implants were not usually used every day in every practice around the world, like maybe today. And there was no chance to restore a smile the way we are able to do it right now. We can do one-day surgery, we do immediate implantation cases. I do that all the time. We take out the teeth, we augment the bone, we put in the implants, and then we have pre-planned and prefabricated bridges, what we put on top right now. And a lot of the patients, let's say 50, 60 years old, when I tell them what I'm able to do and what I'm planning to do for them, they go like, yeah, and when do I get my teeth? And then I think, yeah, I just told you 3 times, you get it right away. And then the person goes back and says, yeah, what does right away means? Is right away 2 weeks? Or is right away 1 month? What is right away? I said, no, right away, the same day. I put you asleep, I take out the teeth, you get the implants, I put on a bridge, everything is fine. When you wake up, you are reborn with new teeth. And most of the people, maybe 60 years old, they cannot even understand that. They have never heard about it, they have never seen it on television, and they cannot imagine how it would feel like or how it will look like. So we use a lot of planning tools like smile designing software, and especially from the MegaGen guys, they are like the biggest inventors I have ever seen in my whole life. These implant developers from Korea, because they are able, with their R2Gate techniques right now, I use the oral designer from R2Gate right now. For example, you have a little iPad, and then the CBCT scanner, digital data, goes into that iPad. You send it via email. Somebody is sitting there the whole day and night in Korea and planning it, and then you go on TeamViewer, or you can actually communicate with them every time you want. And then they plan the implants for you, and then you just push the button and say, okay, that's the way I want it. I want 6 implants in the upper jaw, 6 implants in the lower jaw for my patient. I want PMMA or full ceramic bridge, and they can produce it before you start the operation. You place the implants through surgical guides to make sure that the implants are in the right spot. Actually, maybe it sounds complicated, but it isn't, because I'm just on the end seeing the results. I don't have so much work with what I'm just talking about. We have a lot of people in the R2Gate centers or in the dental lab in Germany who's taking a lot of work from us, or they are doing a lot of work for us. So I just see the result. On the day of surgery, I have the surgical guide laying there while I put the implant through. Once this is done, I screw on the little abutments, and then I just reshape maybe the bridge a little bit. I cement it or I screw it down, and then I just have to check the occlusion.
So when you were talking the R2Gate,
yes,
that's a MegaGen product.
Yes.
For the designing. What CBCT do you use with that?
I use the Gendex CBCT.
So is the R2Gate agnostic with a CBCT? It'll work with various CBCT, all of them, or?
Yes, that's not a problem. They use regular DICOM data.
Regular DICOM.
Which is like JPEGs for pictures. It's regular DICOM data where you just connect that to the software. It can read it, and then it can recreate these virtual pictures that you have, 3-dimensional pictures of the patient's jaw. And actually, we have a pretty big CBCT scanner, so you can actually scan the whole head if you want that. You have the lower jaw, the upper jaw, and pretty much of the cranium, since we also operate like 1 or 2 centimeters higher.
So when you say you extract the teeth and place the implants and deliver the teeth right away, is that all on 4? Or
we pretty much never do all on 4, because all on 4 needs a shorter row of the teeth. So the row of the teeth usually ends at the second premolar. We rather go for all on 6. That is like our minimum.
So all on 6, and would those be in the alveolar bone, or would those go into the skeletal bone? I mean,
no, we like to stay in the alveolar bone, because we also care a lot about the appearance of the soft tissue. Because in my eyes, that's the most difficult trick you can do for your patients, to put in the implants and to make it look like a natural tooth. And for that, you really need to place them in the right situation, that the soft tissue can really attach to every side of the implant.
And if you placed 100 implants, what % would be what kinds of implants? I mean, are they all MegaGen, or are they all?
Meanwhile, they are all MegaGen. You know what?
Right now
because I'm so stressed out and worn out from using any other products, because MegaGen is like right now reaching a peak of modern technology. And sometimes, because we also have referring dentists from the outside, they send patients and they ask us to put in another brands of implants. And then a couple of years ago, I did that while I was grinding down my teeth and getting stomach ache from it. And then I just grabbed the phone and called back and say, you know what, I have a better solution. Because it is not only the surgical screw that is so brilliant about MegaGen, but it's more about the prosthetic parts, because you don't want to limit yourself to the prosthetic solutions that you can find later on. So I want to feel completely free. Once I put in implants, patient can change his mind. Maybe you see some difficulties trying to produce the restoration that you planned in the first place. You can change that at any point of time. And for example, when we put in immediate loaded bridges, we want to change that later to a final restoration. We do full ceramic zirconia bridges, and they have veneers on it with cutback technique. So the teeth actually appear completely naturally. They look translucent, and from outside the oral cavity, I think nobody would see that this is not her or his real teeth. And for that reason, you maybe have to switch abutments. So I don't want to be limited that I have to go for titanium abutments. If I don't want to, then I would rather do hybrid abutments with glued-on zirconium caps on it, or I want to screw down something because maybe it's difficult when you're in a situation where you have produced a pre-milled PMMA bridge. Then maybe you want to glue that with flow plastic and screw it down. So I need a whole variety of abutments. For me, that is the big secret. Not so much the implant screw. The implant screw is really nice, it's beautiful, but for me, like the biggest part right now, 2018, when you use implants, you need a whole bunch of different abutments that you are free in your decision, and you can do your kind of dentistry what you planned. So I use minimum 3 sets of abutments during one treatment. So I'm completely free. I can start with a screwed down PMMA bridge. The next thing can be something on titanium abutments, and the thing after that, maybe something is also a problem about the pricing. So the patient says, you know what, give me fixed teeth right now. I come back next year. I got promised some money, whatever. And then I want the full zirconium, holy moly, give me everything. And then we go for full zirconia.
And by the way, I just want to let you know that these aren't paid commercials. Megagen didn't ask me to do these podcasts. I had to beg them to come down here and podcast for speakers. It's not a commercial. I'm too old and fat and tired to be bought and paid for. This is all from the heart. I mean, is this from the heart?
You know what? If you would know my story, how I got to Megagen, you would believe me that I'm not paid for saying this, because when Germany or the German dentists, they think they are the middle of the universe, which unfortunately they are usually not.
The German dentists?
They are not anymore.
But you make the finest cars, Mercedes, Volvo, Porsche. Yeah. This is the country that makes the Chevy and the Chrysler.
Yeah, but unfortunately, Mercedes is not doing dental implants. The problem is with that product. Many years ago, I was using, let's say, the regular implants. For example, a Biocare, Straumann, Camlock, whatsoever. There's we had
Camelot. Who made Complant? Was that Dentsply, Camelot?
No, we also use Dentsply, just to renounce everybody.
Who is Camelot?
Camelot is from Switzerland.
Okay. So totally separate.
Yeah. It's a smaller company, but they do also produce brilliant implants. But I had, some problems here, and when I had to put in Dentsply implants, they had loose abutments sometimes, or there were things that would break maybe once in a while, so that really annoyed me. And then I started with using Facebook, Twitter, the internet. So as you can see, I'm not like the 17-year-old guy just reborn with a mobile phone in his hand. So I actually know the times where nobody had a mobile phone. So I started with Facebook, and then I saw these implants once a while that a colleague from the other end of the world would use them. And then I thought to myself, or I also talked to my wife, who's a specialized colleague also in our clinic, And she said, yeah, why
Right
do
there?
Yeah.
So is she a dentist?
Yeah, she's actually not only there because she looks beautiful, she can also work as a dentist, yeah.
So she's a dentist?
Yeah, she's a dentist.
Smart. You got beauty and brain.
Thank you, 100
Good
points.
for you.
And I have to admit, I told my wife, and she said, yeah, go for it. And I said, yeah, but maybe they are not available in Germany, that gives me toothache right away. I don't know if I want to stress myself so much because I have to buy them from another place in the world. And then I tried to figure out where I could get them. There was like a really small company in Germany who would sell that, and the company was provided by one person. That is a lot of years ago. And then I talked to that guy, and he offered me to just use it, to try it, and I still had some stomach ache using it because I was thinking that is like a one-man company selling these implants from South Korea. It did not feel well during that time. The products were brilliant, but that business connection was like you're buying it on the black market, and hopefully you get a bill for it so you can give it to the tax office or what. So that was like really some dark times. And then Megagen started to grow bigger. In between 1 or 2 years, it made boom. And there was the company, the representative, the CEO in Germany coming to my office talking to me saying, yeah, I'm the representative of Megagen. I said, you would never believe how I bought these implants before you were there. So I started like really basic using those, and it came from my heart because I was so sick and tired. I used all the implants on the market for the last 20 years. And I found it to be really stressful sometimes because whether the implant screw was not really sharp-edged, so you had problems with primary stability, then you had problems with breaking or loose abutments and stuff like that really made me sick and tired.
So what do you think, I mean, Dr. Park, who's here today, what do you think his advantage was? Most people after Dr. Brandmark and no BioCare would be hesitated to even go out and compete with a company like that. What do you think his secret sauce was, and why do you think he was able to go against a company founded by Dr. Brandmark himself?
You're asking about some magic stick or so?
Megagen, yeah. Yeah.
I don't know where his magic stick is. The thing is, I think these guys from South Korea, they are, in the first place, they're really hard workers. I have never seen something like that. And actually, as you told all the viewers, that I studied in the United States, and I was actually thinking those are the hardest workers on the planet because I had to show up in the hospital at 4 o'clock doing pre-rounds, offering my knowledge to the next guy in line who was the senior resident, and he slapped my ass when I forgot some numbers or whatsoever. So this thing was going on until late night, or I slept in the hospital in front of some Apple computer and bounced my head against the screen. And so I was thinking that the Americans are really hardworking people, but I think the Korean guys, they have a 7-day work week. And I think
7-day work week?
Yeah, you can also call them on Sunday if you're bored. And the thing is, but on top, they are not so scared to try something new. And that is something I feel in Germany a lot. People are really scared. They have so much things going on from the internet, from their clinics, from their responsibilities, so much things going on that they are actually satisfied with doing their little thing. But to break out of that frame and start something new and trying something out here and trying something out here, you risk every time that you fail. That makes you scared. It would make me scared because I also have to do that. So this year we invested some money in a new clinic, in other things in Germany, so I know what I'm talking about. That makes you scared because you have sums of money going out that it's not all yours, and that makes you scared. So they started the same way. They had investors, they had banks in their background, but they would dare to try something new, and actually you risk that you fail.
You know, I've said it 1,000 times, if you ever want to know what made America great ever, was that people voted with their feet and they immigrated here for 500 years from every country on earth, And when I look at dentists coming out of dental school, if they were not born in the United States and they open up, man, they hustle. I mean, they work 12 hours a day, 6 days a week. But if they were born and raised in the United States, I mean, right out of school, they would have worked Monday through Thursday, 8 to 5, buy a nice German car. And then when you lecture around the world, I mean, when I'm in China, most of China, the norm is 12-hour days, Monday through Saturday. And then when you talk to them, like, how do you do that? They go, man, Sunday is the hardest day because I have to do all my cleaning, cooking, all that stuff. I can't wait to get back to work on Monday and relax. I mean, the work ethic in other parts, it's very different. In other words, like work ethic in Greece and Spain and Portugal is very different than Denmark and Norway. I mean, it just is. I mean, cultures, but you're right. They're hard working.
But actually, for
Long
me, my experience at the Harvard Med School, thank you for that, really turned my life around. Because I was very young, ambitious, and I thought I'm like a major hotshot, which I have not been during that time. But they showed me something, and they taught me so much, which I appreciate right now. And I thought to myself, you really have to have some balls in the United States to do that, because you start with college, then you go to university, then you try to involve yourself in some Ivy League university. You have like a major bank debt up to your head, like your whole life will go down south if you cannot finish medical school. So they have a lot of pressure and they work hard. For example, I would stay at a really cheap place in Boston. It was cold and dark and much outside Boston, and there were a lot of other students living in like a big house. And when I talked to them, I actually got more and more quiet, because they impressed me with their effort to put in a lot of work for their goals. So I have like the biggest respect for all the American dental and medical students, because they have to put in so much work. Because in Germany, it's like a more secure system. You know, once you're in dental school, medical school, the costs are overlookable. It's not so dramatic, and I would say you can manage that pretty easy. Because I saw the difference in the United States. I saw, wow, that is war. You really have to stand up and do something. It's not just sitting there and waiting the whole day, drops by, and then you write a test and then you are done. You have to do much more. And I gained so much from that time. I still profit from that time right now, because they made me do things. Yeah, Steven, hey, that's our friend from Germany. You give a lecture next week. And I was thinking, they are talking about me? What lecture? I have no clue. What do you want me to talk about? So I gave my first lectures actually at the Harvard Med School, when other people would sit in the background eating pizza and drinking Coke. And yeah, so they would teach me a lot, and they gave me that deep appreciation of what you can achieve when somebody just says, you go. You grab something, grab your iPad, prepare a lecture, I don't care, do something about the head, impress us. So.
I'll tell you, lecturing around the world, I've been to dental manufacturing companies all around the world. Germany is absolutely a different breed of cat. I mean, you go into, I've been into so many German manufacturing companies, whether it be Cavo or Dentsply or Ivoclar is Liechtenstein, but that's kind of Germany, isn't it? It's right next.
Let's pretend it is Germany. Yeah. It's close.
Well, it used to be Germany, didn't it?
Yeah.
Didn't Liechtenstein used to be Germany? Then they carved it off for the king or something.
Yeah, but that is like a long time.
Yeah. But I mean, you go. Here's the one thing I notice about German plants. When you go into German plants, I mean, eat off the floor, completely organized. The protocols. I mean, there's even protocols above the light switch, when to turn it on and off. I remember I was in. It was either Cavo or Sirona or one of them. I said, "Where's the bathroom?" She said, "Follow the pink line." And I looked on the floor, and there's like 6 different colored lines, and one went to the lobby, one went to the bathroom. And then I would go in there, and I would say, "Well, where's your marketing department?" They'd say, we don't have one. And then you go in there, and they'd have like 60 PhDs. Then you go to American companies that might do 100 million in sales, And you go, I'd like to meet your PhDs. We don't have one. And then you go into a marketing department that'd be as big as this room. You'd have 50 people dialing for dollars and a cheerleader and a thermometer. Americans are masters at selling stuff. And they're all dialing and selling, and they have daily production goals. But the product, there's nobody with a PhD. And then you go to Germany and Switzerland and Austria and Liechtenstein, and they have scores of PhDs, and they don't do any marketing. Then you go to China, and the model is just like, we will just make it so cheap, you'll just have to buy it. And I always look at the three corners of the world, or those three worlds, and say, okay, the Americans should learn from the Germans and get more R&D and make a higher quality product. You should try to get your Chrysler and Chevy more like a Volvo and a Mercedes and a Porsche. And then I go to Germany and I think, okay, you guys should do more advertising and sales. And then China, I always go to China. I go, China, I've been all around the world. I ask anybody all around the world, what is your favorite brand from China? Yeah. They can't name a brand from China.
Yeah, it's a brand that they have copied.
They'll say LT. I'll say that's Korean. They'll say Hyundai. I say that's Korean. They'll say Toyota, Honda. I say that's Japanese. I say name a brand from China. You can go to any Walmart. They sell 60,000 SKUs, and I'll ask anybody in Walmart, name one brand in this store that's made in China. They go, well, isn't everything made in China? I say, I'm not talking about where it was manufactured. I'm talking about the brand. And so I always tell China, what I would do is quit getting everything so damn cheap. Build a brand. Can you name a luxury brand from China? So that's my point. Americans only excel at one thing. They're the masters of sales and marketing. The advertising agencies in Manhattan are to die for. And the other companies around the world are very smart. When they want to sell their foreign car in the United States, they don't use an advertising agency in Germany or Japan. They get one from Saks Fifth Avenue. You know what I mean? And that's what I was trying to do. Just quit trying to be the lowest cost and try to develop a brand. Go instead of just the value play, do a premium play. But I love German manufacturing. I think it's the greatest. And my favorite city in the world, by the way, is Cologne. So it's the largest dental meeting in the world, the International IDS meeting. It's in Cologne every other year. They have minimum 100,000 dentists show up. Every dentist you talk to is from a different country. This guy's from Tunisia, Korea, Brazil. They're from every country on earth.
Yeah, it's huge.
It's huge. And they do it every 2 years because that's the product launch cycle for all these amazing companies. They say, okay, we're going to spend 2 years developing this, and then we'll launch it 2 years from now at the IDS meeting. And my gosh. And then the other thing I like about Cologne, it was the farthest outreach of the Roman Empire 2,000 years ago. So they still have the Roman Empire wall around it. So it's the only place I've been in Germany where it's like where Italian cuisine and beer and wine meet German beer and cuisine and wine. And it's so fabulous. It's so quaint. And what I also love about it is of all the international cities I've been in, that city knows that you're lost and confused tourist, and every citizen in that town will help you find your hotel. You're trying to get on the train in many busy cities. Go try to get on a train in South Korea or Tokyo, and you're all by yourself. In Cologne, Germany, a little 10-year-old kid will say, "Do you need help?" And you're like, "Yeah." And then they'll do the whole transaction for you, and it's just
Cologne is like a really unique place in Germany. It's really unique, and you will find really cool people there.
It's the coolest city in Europe. I really like it. Yeah, and the beer is to die for. So I want to go back to some questions for implants. Obviously, Americans would pay twice as much money for braces if they could be done in a day. Nobody wants to have braces for 2 years. And in implants, a lot of these dentists are, is the dog wagging the tail, or is the patient the tail wagging the dog dentist? They want their implants immediately loaded. If you placed 100 implants, how many of them would be immediately loaded? And what is your thinking?
I think right now, but that is also depending on that I'm doing really special things. Because I would be so happy if you would come to my office and see me and I only had to put in one single implant. Unfortunately, in one way, in the other way, I'm a really lucky guy. There's only complete catastrophic patients showing up in our clinic. So they need 28 crowns, they need minimum 12 implants, all their teeth have to go, because we have the image in our region, and people sometimes travel from Hanover or Bremen, or we have patients from Frankfurt or whatever. So they have heard about us. We even had patients from Russia, and they expect us to do the job the same day. And there's pretty much no patient or really rare customers that show up and they want 2 implants or 4 crowns or something. It's more the big catastrophic cases. They have heard that we can help them. And for us, as you were talking about selling a product, our biggest selling product is the soft sedation technique that we developed ourselves.
The what?
The soft sedation technique.
Soft sedation
Because
technique.
most of our patients are scared. They could also see a brilliant colleague in Munich, they could see brilliant colleagues in Dortmund, they could see brilliant colleagues in Hanover or whatever. So what they are looking for is that soft sedation technique, which is not total anesthesia, but it's just a mild sedation. We can put people asleep for 3 to 4 hours. They will be awake right after it, and they will have no headache, there will be no nauseousness,
IV
stuff
sedation?
like that. It's IV sedation in combination with inhalation techniques. And some of our customers, they come back just for that. They say, okay, I have to...
So it's inhalation and IV?
Yes.
What are they inhaling and what are you putting in the IV?
They are inhaling a special combination between laughing gas and oxygen and other things I cannot tell. But it's not like severe medication, but it's taking away their anxiousness, so they are really relaxed. Their pulse is down to 60 while we are operating. We also use certain local anesthesia solutions to numb up everything intraorally, so they will not feel any pain. When they wake up, maybe there's some areas that are still numb in their faces, but otherwise they have completely no pain. And then they go on internet and Facebook and Twitter and Instagram, and they post that for us. They say, I just had my surgery done and that is great, I will do that again. So sometimes we have patients, maybe I take out the wisdom teeth and then they come back and say, you know what, when I have crowns, I want the same sedation techniques and I want my crowns.
So why do you call it soft sedation? Because it's not just putting them out with an IV?
It's an IV technique, but it's soft because it's like a special combination of a medication, of different medications that they don't have so much side effects, and it's not strong. If you want to use one of those things, it would not really put you asleep, it would not really take you out, but the combination of these things, which are not so harmful medications if you take only one of them, but the combination is making the trick. So it's really soft because it does not take the patients out so much. They are asleep, they go on while they are laying there, and you can operate really smoothly on them, and when you let them wake up, they are here right away. It's no dizziness. And
I thought it was
no
funny
spitting.
the endodontists want to quit using the word root canal and call it endodontic therapy, because root canal is a bad reputation, and they're trying to get away from that. And it just makes you laugh. It's like almost every endodontist I know doesn't even have laughing gas.
Mm-hmm.
It's like, instead of trying to change the word root canal or to endodontic therapy, why don't you go get all the endodontists just to use simple laughing gas? I mean, I can't tell you how many endodontists in America, if you said, well, can I have an anesthesiologist come in here and put me to sleep in a root canal? Oh, you don't need it. Lean back, go. So it's just a matter of hustling and listening and having empathy towards the patient. And I don't care if you're an endodontist and you don't think the patient needs it. If the patient is scared and wants laughing gas or wants to be put to sleep, why is it just a no? And raising 4 boys, I got 4 boys who have now turned into 5 grandchildren, maybe. I went to the emergency room so many times, and in Arizona, I'll never forget a little kid in there fell into a cactus. They were pulling out his. He's crying and screaming the whole 9 yards. And I said to him, all these doctors, and I said, well, why don't you have laughing gas? And they're like, what? I'm like, you're an emergency room. You just are always telling people to suck it up, buttercup, and that just is what it is. Like, when you study the market, half the people are afraid of the dentist, and half the people are afraid of the cost. And which I wanted to ask you next. For all these big cases, how are people finding the money for this? Do you offer installment credit? Do you finance it? Or are these people coming in with catastrophic cases and a lot of cash and just writing you a check? How does that work?
Actually, that is weird, and it's a really brilliant question, because sometimes I sit there with my wife and all the colleagues in the clinic, and we are scratching our heads and thinking to ourselves, where's the money coming from? Because the person looks like living on the street. And you tell them, yeah, that she had to bring like a truckload of money, and she goes like, yeah, okay. And you think, yeah, no question, no further question. Do you need some paperwork or whatever? Sometimes it's really weird, and I think for us the secret is maybe pretty plain, because we try to provide a really human and natural service for our customers. So we really care. Once you entered our clinic, everybody will ask you if you are okay. If any one of our team will see that you are scared, or you have trouble breathing, you are nervous, you play around with your iPhone, somebody will show up and ask you, can I do something for you? Are you stressed? Why are you stressed? Do you want to come with me to the next room and talk about it? And then we start very, very, very slow, making friends with the patients. And sometimes we have situations where I'm sitting with my wife in a treatment room, and we talk to a person like for 30 minutes, and then she goes out the room and says, okay, then I make an appointment. And my wife and I, we stare at each other and we go like, she did not ask for the price. So sometimes that is weird. Actually, we provide everything. If you want to finance it, we can provide you with that. If you want to,
what percent finance it?
Actually, for a couple of years, we would not care so much, because we have a provider who's completely 100% service-oriented, and he provides everything. We just exchange numbers with the patients, and then they take care of everything. That's like the whole concept of our clinic, that once you come to us and you have problems with anything, we take care of it 100%. You don't have to move anywhere. Somebody will come to your place, somebody will call you, somebody will write you an email, or you call there, they call you back. So, and I think the last year we had 3 to 4 people financing anything. And it was not even the big cases.
So it just shows people find the money for what they want. And dentists are always telling me, I don't like the term United States of America, because I always think of like Germany. If you call the EU the United States of Europe, well, you can't compare Germany to Spain or Greece to Denmark. I mean, they're totally unique countries. Yeah. And the United States, there's really no United States. It's really at least 9 different countries flying under one flag. You can't compare San Francisco to Wichita, Kansas. How do you compare Manhattan to Miami? I mean,
to Las Vegas.
Yeah, Las Vegas, which they call here Sin City. I mean, everything they're doing here, gambling, drinking, all that stuff like that. I mean, that's so taboo in the South, So even the Federal Reserve, when they're trying to monitor the U.S. economy, they look at it as 9 different countries. So a lot of times I'll be lecturing in what a lot of people think is a poor part of the country, like an agricultural country like Kansas or Iowa or Omaha, Nebraska. And they'll say, well, these are just corn farmers. And I'll say, okay, we're at a restaurant, look in the parking lot, what are all the vehicles? And they go, and I'll look at it and be like 10 trucks. And the F-150s are like $50,000 a piece. The F-250s are $90,000 a piece. And the F-350s are $110,000 a piece. I'm like, okay, so all these poor farmers, I got $50,000 minimum for their truck.
They could also
maybe
invest
90.
In their
So they could absolutely invest. If you got $50,000 for a truck, you got $50,000 for a smile makeover. which totally could change your life.
Yeah.
Last question. On your lecture, you also talk about you teach your colleagues to manage stress, fear, team building, and focusing on goals. I want to finish. Last question on when I ask 100 dentists what stresses them out the most, they always say their staff. They never say it's the filling, the crown, the root canal. When they get on Dental Town and their stomach's just gurgling, it's because they're having an issue with the staff. So what advice would you give these kids on how to team build and manage their team and their staff better?
I think the problem with team building is always that once you are the head of the team as being the owner of the clinic, you should always talk last and you should just stick to questions, because that gives you the opportunity to gain knowledge from all your team members and also to understand how they tick. Usually in the regular clinic, I think it's done the opposite way around. The head of the clinic, the head of the team, the boss of the clinic talks first, does not accept anything and tells everybody what to do. And then is the result not satisfying. For me, a key point is when you understand how your people tick, how they work, how they go, how their private life is going. You can create a team by trying to understand everybody and give them a good view on what your goal is. So we sit down every week with all our team members and we tell them what our vision for the future looks like. And then they are actually really proud to participate in that team. All the assistants, they're really proud. For example, we talk about service. For me, service means that when you have a person sitting there in your clinic, the first time you do not know anything about that person. Service means you go there and ask that if you can help before they ask you. So you need to have a sense of what is needed. Is she scared? Is she just bored? Is she stressed because she needs to be someplace else? We have a little fleet of company cars. We have like these little smarty cars, 3 of them right now, but we are actually planning on expanding it because, for example, the person is sitting there being stressed. One of my assistants will go there and invite you to take you home. And then we call you once your husband or your wife is done in our clinic. We give you a call. You can come back and pick him up. There's no need that you sit there and wait, being majorly stressed because you want to be someplace else. And for me or our team, that means service. And actually, I saw in all our employees and all the colleagues that work for us, you can see a glance in their eyes when they are successful with these techniques. And that is how you build a team. You give them something where they can be successful with. And that makes the team.
I would love to get your lecture on Dental Town. I think you're amazing.
Thank you very much.
Be interested in that, an article in Dental Town magazine?
Yeah, sure.
Oh, I would love it. The Americans love it. You got it on tape. We got it on tape. When he says no, we'll play him back this tape. Thank you so much for, you're so busy here, you're lecturing, to find the time to come by and talk to my homies for an hour. That was fantastic.
Thank you very much.
Thank you very much.